When you are considering an important procedure like low anterior resection surgery, it is natural to wonder about every aspect of your recovery and what challenges you might face. This kind of surgery is a significant step in treating conditions such as rectal cancer, and understanding potential outcomes is a key part of preparing yourself for the journey ahead. Low anterior resection surgery, often referred to as LAR, is a generally safe and effective procedure. However, like any major surgical intervention, it does come with a range of potential risks and complications. These risks can be broadly categorized into general surgical complications and those specifically related to the removal and reconnection of the bowel. The general risks associated with any major abdominal surgery include possibilities such as infection at the surgical site, bleeding, and the formation of blood clots, which could potentially travel to the lungs or other parts of the body. There are also risks related to anesthesia, though modern anesthetic techniques have significantly reduced these concerns. Your medical team carefully monitors these factors throughout the process. More specific risks to low anterior resection surgery relate to the manipulation and healing of the bowel. One of the most significant concerns is an anastomotic leak. This happens when the two ends of the bowel that have been surgically reconnected do not heal perfectly, allowing contents to leak into the abdominal cavity. An anastomotic leak can be very serious and may require further intervention, sometimes even another operation to create a temporary or permanent stoma. Another specific risk is low anterior resection syndrome, commonly known as LARS. This is not a leak but rather a collection of symptoms that impact bowel function after surgery. Patients may experience increased bowel frequency, urgency, difficulty controlling bowel movements, or a feeling of incomplete emptying. While these symptoms can significantly affect quality of life, there are various strategies and treatments available to help manage LARS. Other potential complications include bowel obstruction, where scar tissue might block the bowel, and damage to nearby organs or nerves. Damage to nerves in the pelvic area can sometimes lead to temporary or even permanent urinary or sexual dysfunction. The likelihood of experiencing these risks can be influenced by several factors, including your overall health, the stage and location of the disease being treated, the extent of the surgery, and the skill and experience of your surgical team. For instance, patients who are older, have other underlying health conditions, or requiring a very low anastomosis close to the anal canal may face a slightly higher risk of certain complications. To help minimize risks, your medical team will perform a thorough assessment of your health before surgery. They will also provide detailed instructions on how to prepare, which might include dietary adjustments or specific medications to take or avoid. After the procedure, close monitoring and adherence to post-operative care instructions are crucial for a smooth recovery and for identifying any complications early on. Understanding these risks allows you to have informed conversations with your surgeon and healthcare team. Do not hesitate to ask questions about how these specific risks might apply to your individual situation. This proactive approach ensures that you are well prepared for your surgery, feel more in control, and are ready to manage your recovery journey with confidence and knowledge.